Recording in progress. Okay. Good morning. Good morning, everybody. Nice to see you. Glad to have you here. Give you a few minutes to file into the room and get ready to learn, some riveting health information. So how are you doing today? I just got out of the shower, did not have time to dry my hair, but that's okay. It plays the thing, Amy. You just have to. The important thing is the nerdy stuff, right? So we'll get right to it. Anyway, let me just see who you are. As you come in, hello, hello, hello. Hope you're having a good Saturday so far. Starts out chilly right here. Well, we're in Keene, New Hampshire. That's where I am. And some of you are as well, some in the surrounding towns, and some of you are totally across the country. But we're starting out our March days like in the low 30s or high 20s, and then kind of ramps up like by 4 o'clock or so. It'll probably be around 60 degrees out. So it's a matter of layering, right? Wear your layers. So anyway, this is Wondrous Roots, your health from the ground up. My name is Becky Montrone. I have a business here in Keene called Wondrous Roots. Wondrous Roots being the roots of health and disease. So most times when somebody has a health issue, it has to do, or more than one health issue, there's some sort of a connecting root in that person. I'll give a few examples in a little bit. That happens all the time. So we want to get to the roots of health and disease. We want to treat the roots. We want to fix the roots of fixable, nourish them, water them, fertilize them, if you will. And then maybe address some branches in the meantime, but then we want the branches to just begin to flourish in the whole health picture. So that's kind of Wondrous Roots, roots of health and disease. My family roots, my father was a compounding pharmacist, and he's known in his industry to this day. He passed away in 2011, but he is considered the modern godfather of compounding pharmacy today, and all compounding pharmacists know his name. And so he gave to me the DNA for the love of looking at a health problem and trying to make a product to help. So I'm a full-fledged herbalist as well, working with botanical medicines. And then my mom was a Navy lieutenant nurse, right out of nursing school. She took herself off to when she was 16 years old to join the Navy. That's where she met my father, was a Navy lieutenant nurse. But my mom had, and really gave up me my passion for nutrition, supplementation. She was a big Adele Davis fan. And I read her book, her copy of Adele's book, Let's Have Healthy Children. I was 16, which really, sparked my passion for, we have so much more control than we think we do if we only know the things to do. And so nutritionally, health-wise, but my mother started showing signs of Alzheimer's disease at the ripe old age of 49. And that was a real, a sadness and everything, but it also really shaped my going on to learn more things about how to prevent and prevent disease, and even diseases that can be genetically we could be predisposed to. So those of you who are used to me, you know all of that. And then Wondrous Roots, using the medicines of the earth, using things that come from our creation, whether they be nutrients in foods, amino acids, proteins, macronutrients, minerals, and proteins, carbohydrates, and then vitamins and amino acids and all kinds of nutrients that eventually come from the earth. And and herbs, botanicals, things like that. So I hope that explains that well. We are open here. I see clients in private consultation for all kinds of health problems, all ages. And I do that either here in my office on Roxbury Street at the Miller Forge building in Keene, New Hampshire, or online like this via Zoom for those of you who are out of reach locally. Number here is 603-439-2603. I have 2 websites, wondrousroots.org, which is basically my more learning informational website, and then shopwondrousroots.com, which is our full shop and our products online. So I have a lot of products that I've formulated myself and that we make here ourselves. And then I have a lot of products that I stock for the convenience of my clients and customers, other things from other companies. Okay, so I gave the phone number, I gave the websites. You can reach out to me, contact us from either of those websites. It comes to my private email and I will get in touch with you. And I think that's it before I dig in for today's program, which I gave a big tease last week and I said I was going to talk about fluoride. And I'm not because I actually got going on another topic in the meantime, building a page on it for a client, in particular for working with a client. And I just decided to go ahead and move with that page and didn't really have time. I don't have a lot of time to do extra stuff, but client work during the week. So for research and things like that. So I will plan my dental program and my fluoride information, aim for that for next week. How's that? I know I said it last week, but you have to forgive me. You'll be interested in this anyway. Okay, so today we are going to be talking about the vagus nerve. The vagus nerve I've talked about many times because the vagus nerve is the 10th cranial nerve. It is involved, it comes down from the left side over here, and then it branches out to the right for certain functions and to the left for certain functions. It is the major nerve in the body that controls the parasympathetic or the autonomic, the parasympathetic nervous system. So we're going to talk about that a little bit, and I'm going to dig in. I'm going to take you to my page, and I'm also going to, oh yes, if you want to participate, and please do, you can type into the Q&A, the chat. You can type into the Q&A, you can type into the chat, or you can raise your hand and I will call on you. And then let's see what else. I think that's all I wanted to say. And you don't have to stay on topic. So whatever you want to talk about, go for it. All right. Let's go. Site. And maybe I'll just go here first and share my screen so you can come along for the ride as I get to where I'm going. Move you guys around. Oops. Okay, what did I do on there? Okay, chat. Do not want my chat box so big. Oh, there we go. And then need to get you guys so I can see you. Who you are. Again, if you're on the Zoom, nobody knows who you are except me. Nobody sees who's here or anything. So you know that because you can't see it. All right, so let's see. There's my screen. I think that's a pretty good size. So if you want to find this page easy without going to the long tab down there too, you just type in vagus nerve. And you'll see there vagus nerve, autonomic nervous system. And there you go. Takes you right to it. Otherwise, you scroll down from there and you can see it there. And there we are. So I'm going to start out with a brief description. We're going to watch a short video. Well, I'll tell you in a second. But anyway, the vagus nerve, the longest cranial nerve, cranial being head, right, is a key regulator of the autonomic nervous system. The parasympathetic rest and digest and sympathetic flight or flight responses. It controls vital functions such as heart rate, digestion, inflammation, and stress regulation by transmitting signals between the brain and major organs. Now, we talked about this quite a bit a couple of weeks ago when I talked about earthing, grounding, using those techniques, because that's what they really do, is they help you tone your vagus nerve. And in so doing, they affect tons of areas of health. So we'll talk a little bit more about that coming up. So anyway, a strong vagal tone promotes relaxation, enhances digestion, supports immune function, and reduces inflammation, while low vagal activity is linked to anxiety, poor gut health, and chronic disease. Stimulating the vagus nerve through breathing exercises, cold exposure, and meditation can help restore nervous system balance and improve overall well-being. Yeah, it's really, really important. And the kind of cool thing about it is that we can do something about it. It's not like a perfect world. It's not like you can take, make sure you take this pill twice a day and your vagus nerve is all set. It takes some activities you have to engage in yourself and make time for. They're not time consuming, but I wish there was a way to really just fix the vagus nerve. If somebody has a problem, just fix it, maybe once and for all, right? Something like that. All right, so this reminds me of the film strip days back in my grammar school days when we would be in your class and your teacher would have, those films. I'm dating myself, so some of you don't know anything that I'm talking about. Some of you totally do, but the film strips. So this is a video, but I want to play this because I think it's much better than just to talk about it and describe it for you to actually see the pathways. And it's not very long. It's only about just over 6 minutes. So if you don't mind, I'm just going to just indulge me with this, and we'll watch this on YouTube, and a YouTube within a YouTube. Now, I'm wondering if that actually is, we might have to do it this way, because I think that might take it out of my Zoom if I try to do the whole thing. So, okay. All right, let me turn it back. Let me, can we hear it? Unmute. And then let me see, if it's coming through my system. We'll find out. I think I did this once before and it worked out okay. I don't hear anybody though. Do you guys hear anybody? No. Oh, darn. I don't know if I'm going to be able to do that. I thought for sure we did that last time. Yeah. Oh, darn. Okay. So here's your assignment. I'm just going to go off this. So here's your assignment. You need to watch this when I'm all done. All right. You can't go do anything. You have to just go back to my page and watch it. Anyway, that's too bad. I wonder if I play it here. If I play it here instead of on the YouTube. Come on. No. Oh, darn. Okay. Well, that's okay. At least like I didn't plan that much of my time on it. Okay. You'll be able to see, but anyway, it runs down here. It has all kinds of, it affects majorly as it comes down. The left side, they affect the ears in certain ways, also very much the vocal cords, your swallowing, your gag reflex. So as it travels down and then beyond, it comes down through the sternum and it goes and it affects like the heart. Let me just show you, I'm gonna find a photo here in my photos. Gosh. Well, let me see if I stop, if I share it to something else. Oh, there it is. Okay. All right, you guys can see that now. I wish I could make it a little bit bigger. All right, so you have here the right vagus nerve. The left vagus nerve is really kind of like your major deal when it comes to the vagus nerve. So it affects the superior laryngeal branch, the left recurrent laryngeal branch, the cardiac branch, the lungs, the pulmonary plexus, the heart, the esophagus, the stomach, the spleen, the kidney, the pancreas, the small intestine, the colon, the liver. So you have so much of your body is affected by this nerve that comes down, back from behind your left ear. Okay, so let's see. Let me go back to my other page. Let's go back here. That should work. And just get rid of that. No. Share. There we go. Sorry about this. A little technical difficulty, but yes, that's what I want. Okay, anyway, the autonomic nervous system. Okay, what is that? So there's two main branches. You have your sympathetic nervous system, which activates the body's fight or flight response to stress or danger. So you need to be able to do that. That needs to activate so you can, run and do what you need to do when you need to. The parasympathetic nervous system promotes rest and digest functions to restore calm, support digestion, and encourage healing. Doing things that you're really not aware of that are going on, of course, unless they're not working properly, and then you're very aware, like as if you have chronic constipation because your motility, your gut motility is affected by poor vagal tone, as an example. Together, these systems constantly adjust your internal environment to keep you alive, safe, and in balance. You don't even notice it. So the sympathetic nervous system versus the parasympathetic. The sympathetic nervous system on the other, okay, these are supposed to be this way, but I did it backwards. We have the sympathetic nervous system, known as the fight or flight system. This branch prepares your body for action, whether you're under real danger or simply under pressure, right? So your sympathetic nervous system can like flood in and take over when you're anxious about something, when you're stressed, or when you're stressed in a chronic way as well. So it increases your heart rate and your blood pressure, dilates the pupils, shuts down digestion to divert energy to your muscles, stimulates the release of adrenaline, mobilizes blood sugar for quick energy. While the parasympathetic nervous system is one of two branches of the autonomic nervous system, which governs all the automatic functions of your body, like heartbeat, digestion, and breathing, without even having to think about it. The parasympathetic branch is often referred to as the rest and digest system. Its primary role is to calm the body down after stress, support recovery, and maintain long-term health by slowing the heart rate, lowering the blood pressure, stimulating digestion and nutrient absorption, promoting salivation, tear production, and sexual arousal, encouraging rest, sleep, and cellular repair. So the balance is key. Ideally, they work together in a rhythm like a seesaw. When we need to rise to a challenge, the sympathetic system kicks in. When the danger or stress is over, the parasympathetic system brings us back to baseline, restoring balance, digestion, and healing. Like if you're running from, somebody's chasing you and you're running in if you could say somebody's running in the forest and they're pregnant and they're about to give birth or something like that. They're not going to, they're just going to keep running. That's going to stop. You're not going to stop and need to use the bathroom. You're just going to run. Everything else shuts down so that you can just do what you need to do, shunt all of that energy and all of that nervous system intention to your muscles. And so you can do what you need to do to get out of a dangerous situation. But in today's world, chronic stress keeps many people stuck in sympathetic overdrive. Probably you either have experienced this yourself, or maybe of somebody else who does. And that can lead to anxiety, just kind of chronic anxiety, poor digestion, high blood pressure, trouble sleeping. Strengthening parasympathetic tone, often through the vagus nerve, is a key to restoring balance and resilience. This is a really good analogy. So think of your body as a car. Think of your body as a car and the autonomic nervous system as the automatic driving system that keeps everything running in the background without you having to steer, press pedals, or even think about it. It's all that stuff like I don't understand that's going on in the car, like the alternator and the catalytic converter and, all of that kind of stuff. The sympathetic nervous system is like the gas pedal. It kicks in when you need to speed up take action, or respond to danger, your fight or flight mode. The parasympathetic nervous system is like the brake pedal. It slows you down, calms things, and allows the engine to cool off in recovery, your rest and digest mode. The car drives best when both pedals work properly and are used at the right time. Too much gas and no brake leads to burnout. Too much brake and not get enough gas might lead to sluggishness or lack of motivation. The vagus nerve is like the braking system's central line. It carries the calming signals from the brain to many of your organs to help restore balance and conserve energy. There is such a brain body connection, and they can get disrupted. And some of the disruption is even from simple anatomical problems, such as having a small hiatal hernia, like a little opening in the diaphragm so that the stomach is up and you're getting some compression against the vagus nerve as it's coming down through the sternal area, down through the breastbone area, around your heart and stuff like that. So you can get it kind of pinched off, if you will. And that can disturb the connection between the brain and the body. The brain is the body, but you know what I mean, the brain to below the neck. Well, it's to below the brain, because very involved in your speaking and your speech. And it was very interesting. I had a woman stop by a few months ago, and she just popped in, and she had taken her husband to many appointments because he just lost his voice. His vocal cords didn't work. He'd been to, his vocal cords, I guess, tested fine. Nobody could figure out a reason, and it would kind of, once in a while, it would come back and then go away again. And so all I could think of to suggest to his wife was stimulating the vagus nerve. And I've got like this little gizmo here that I'll show you after, that I used to do that. If you can see that, it's a acupressure pen, quartz operated, and I'll show you, I'll demonstrate. And I've got the demonstration on my page too, but I'll demonstrate it for you how to use it as a quick vagus nerve reset. Anyway, she popped back in a couple of weeks later and said that it had helped, that resetting the vagus nerve, his times of speech were more frequent. And prior to that, nothing they had been recommended or tried, or nobody had any solutions. So my first tip off was that his laryngeal muscles were impaired by a lack of signal to innervate them from the vagus nerve, because the vagus nerve is so involved in the muscles of the larynx. So how vagal tone affects various areas of health. Some health conditions associated with vagus nerve dysfunction, cardiovascular problems, irregular heartbeats, high or low blood pressure, increased risk of heart disease. Big problem in our world today, but I'll bet you, I don't think very often in the mainstream doctor's office is when blood pressure is being discussed, or atrial fibrillation, that kind of thing, heart rhythm problems. I doubt very often the vagus nerve is brought into view. And it's too bad, because it could be right there central. Digestive disorders and conditions like gastroparesis, delayed stomach emptying. So, somebody who has a lifelong history of chronic constipation, that would be the first thing I would think of. The vagus nerve, the impact of the vagus nerve. And then you often find, and this is what happened with my client of a couple of weeks ago that set me off into this. It was the week before last, into doing this starting this page up, that was one of her things. And then there were a couple of other things that were really telling on vagus nerve. The good news is that if you understand that, you can do something about it. Sometimes, however, as in the case with this woman, it's kind of like a double-edged sword. it can be like a double-edged sword, right? On the one hand, you're really glad and you're hopeful that you're going to be able to really make improvements. But then you're like, many people have suffered severe things for a long time. And just kind of the frustration that I could have known this a long time ago and avoided many health problems. Okay, so digestive disorder, yes. Okay, it can also result in moving your bowels too frequently, right? It can be sort of like IBS both ways, vagus nerve associated IBS either way. Mental health issues, elevated anxiety and depression and mood disorders. So that can run the gamut from all kinds of things like OCD, panic disorder, phobia, that kind of thing. Inflammatory or just like always being anxious, always being on the elevated anxiety side, depression, inflammatory conditions. So many health conditions associated with chronic inflammation and autoimmune diseases, poor immune function. I'm going to be getting into it in a little bit. This woman had endometriosis, a long history of endometriosis. And yes, believe it or not, that's one of those things that would probably be something you wouldn't put on your first list of vagus nerve disrupted things. But when you look at inflammatory conditions, that can run all over the place. Poor immune function due to chronic inflammation. Poor immune function can lead to cancer. So we're really seeing that the vagus nerve is a major root. Okay, chronic fatigue, persistent tiredness not alleviated by rest. And the vagus nerve does play quite a role in the production of mitochondrial energy, that basic cellular energy, adenosine triphosphate or ATP, which we need in order to for our cells to function in a more youthful and healthful manner. Chronic fatigue, again, I did a program on that a while back and have a whole page on that. So chronic fatigue, again, think vagus nerve, think I need to be stimulating my vagus nerve. Headaches and migraines, frequent or severe headaches can be associated with vagal nerve insufficiency. Vagus nerve is huge when it comes to regulating circadian rhythm and sleep. You know, knowing when you are your body, your system, knowing when you're supposed to be sleeping, knowing when you're supposed to be awake. And we talked about that in the grounding session, the earthing session. But again, it's doing that through its effect on the autonomic nervous system through vagus nerve support. So the vagus nerve plays a crucial role in regulating the autonomic nervous system, specifically activating the parasympathetic rest and digest response. Dysfunction or underactivity of the vagus nerve is often linked to poor sleep, heightened stress, and autonomic imbalance, making vagus nerve stimulation a promising approach for insomnia. So kind of have an overview there. It reduces how vagus nerve stimulation may help insomnia, reduces sympathetic overactivity. Chronic insomnia is often associated with an overactive sympathetic nervous system, fight or flight, leading to high cortisol, increased heart rate, and nighttime alertness. It's all there. I guess the good news is that, say that's your big thing with vagus nerve insufficiency. Your big thing is insomnia. So if you start to work on your vagus nerve by following some of the practices or choosing whatever practices you want to do that on a daily basis, and it fixes your sleep, it is also supporting all of these other things that the vagus nerve supports: your digestion, your heart, your mental health, your body's energy, your inflammatory state. So you're getting a big bang for your buck, if you will, a big yield for your time and effort. Okay, so we have the nervous system leading to high cortisol, increased heart rate. If you have that sympathetic is in overdrive. Vagus nerve stimulation promotes parasympathetic dominance, helping the body relax before sleep. Increases heart rate variability. Increased heart rate variability is linked to better stress resilience and improved sleep quality. Vagus nerve stimulation enhances heart rate variability, making it easier for the body to transition into restful sleep. So you're not going to bed like, with your heart going like this. Regulates neurotransmitters, stimulating the vagus nerve, increases GABA and serotonin, both of which are crucial for reducing anxiety, improving sleep onset. It may also lower excess glutamate, which can contribute to hyperarousal and insomnia. You know what else does that is magnesium. So magnesium works to lower excess glutamate as well. It's a natural tranquilizer for that reason. And then when we use magnesium bound to a glycine molecule for the glycine, it adds to that, lowering the excess glutamate. But anyway, stimulating your vagus nerve also has that effect. Reduces inflammation. So chronic inflammation has been implicated in sleep disorders. That's really true. And that's why we use things like melatonin, which is a powerful antioxidant. It's also the circadian sleep regulation thing, but glutathione, I got to say it every time. I have to say it at least once. Glutathione is a master antioxidant that works to improve sleep by lowering oxidative stress, and which oxidative stress, reactive oxygen species, which I speak about all the time, increase insomnia. And it's kind of a vicious cycle. The low antioxidants promote poor sleep, and poor sleep promotes low antioxidants, if you will. So again, chronic inflammation has been implicated. The vagus nerve stimulation has anti-inflammatory effects via the cholinergic anti-inflammatory pathway, which may contribute to deeper, more restorative sleep. And then we're going to go through these, how we can help stimulate our vagus nerve. So I'm just going to kind of go off that for a minute and come back to addressing those different ways to do that. But this is a really good website. This is vagusnerve.com. And I actually just stayed on their website rather than making a PDF out of this, because you can get to other things from here and you might want to do that. So here, they go through the whole thing about the vagus nerve there. So the vagus nerve's role in sleep regulation, a complex process that involves several interconnected systems. One of them is the autonomic nervous system, blah, 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 blah. We just talked about that. The vagus nerve and REM sleep. Rapid eye movement sleep is a phase of sleep characterized by vivid dreams and increased brain activity. During REM sleep, the body experiences muscle paralysis to prevent us from acting out our dreams. The vagus nerve is involved in modulating the transitions between REM and non-REM sleep cycles. It helps regulate heart rate variability, respiratory rate, and the overall balance of the autonomic nervous system during different phases of sleep. And that's really important too. You want your sleep phases to go in the progression they're supposed to. And so you go through, I think there's like 4 stages of sleep. Anyway, research has shown that the vagus nerve plays a significant role in the regulation of REM sleep. Studies have found that stimulating the vagus nerve can enhance the duration and intensity of REM sleep. Conversely, the damage of the dysfunction of the vagus nerve can lead to disturbances in REM sleep, resulting in sleep disorders such as REM sleep behavior disorder. Also, it's really a good way for your body to kind of your brain to sort of detoxify when you're sleeping in that stage of sleep, and neuronal repair, we call it, like like everything just getting fixed up that's had some wear and tear from your day maybe, or whatever. And then the vagus nerve and the non-REM sleep, Non-REM sleep consists of multiple stages, with each with its own characteristics and function. The vagus nerve influences the depth and quality of non-REM sleep. It helps to regulate the transitions between different stages of non-REM sleep, ensuring a smooth progression throughout the sleep cycle. Dysfunction of the vagus nerve may disrupt the normal sleep pattern, leading to sleep disturbances and fatigue, right? That fatigue that comes because you didn't sleep well. In addition to its role in sleep regulation, the vagus nerve also plays a crucial role in overall health and well-being. It's involved in the regulation of heart rate, blood pressure, digestion, immune function. Dysfunction of the vagus nerve has been associated with various health conditions, including depression. Okay, so those kinds of things can also affect your sleep. Now, then you've got kind of like a double whammy here. Again, you've got the vicious cycle like we did with the oxidative stress and low antioxidants and not sleeping when I was talking about glutathione, but also poor sleep has been shown to decrease vagal tone. So you might have poor sleep because you have decreased vagal tone, but then your poor sleep also further decreases your vagal tone. So anyway, it's very important for that. Regulates various physiological processes during sleep. Yes. So again, neuronal repair, detoxification, things that happen really marvelously when we're sleeping and really wonderfully, just what makes sleep so important. Okay, so we'll talk more about that, the vagus nerve stimulation shortly. The vagus nerve and the digestive system. So the vagus nerve plays a crucial role in digestive motility, how fast your food moves from your stomach out through to the end, into the toilet. Controlling the peristaltic movement of the intestines via the gut-brain axis. It's really interesting, a technique that's been mentioned for when you're sitting on the toilet constipated is to put your palms and press your eyes with your palms like that, which actually is a vagus nerve stimulating technique, a vagus nerve. Yeah. So it's something like that. So you're getting, if your vagal nerve tone is low, it is very apt to result in digestive problems. And again, constipation is key, but it can go other ways as well. Sluggish digestion, and then vagus nerve stimulation can help by enhancing gut motility, increasing digestive secretions, and reducing inflammation, all of which support regular bowel movements. And then the impact of the vagus nerve on chronic constipation. Again, you can see that there. Anatomy and the vital role, blah, 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 blah. Okay, the vagus nerve's influence on the digestive system goes beyond mere mechanical movements and chemical secretions. It also communicates with the enteric nervous system, which is often referred to as a second brain. This intricate network of nerves is embedded in the lining of the gastrointestinal tract and assists in local reflexes for digestion, absorption, and elimination. Moreover, the vagus nerve acts as a crucial link between the brain and the gut. It relays information about the state of the digestive system to the brain, allowing it to make necessary adjustments and maintain homeostasis, right? So not too much one way or the other way. This bidirectional communication between the brain and the gut is essential for overall digestive health. Interestingly, recent research has shown that the vagus nerve may also play a role in the gut-brain axis, a complex bidirectional communication system between the gut and the brain. This axis is thought to influence various aspects of our mental and emotional well-being, including mood, stress response, and even cognitive function. So we've talked about that when we talked about butyrate and the microbiome and the microbiome's role in taking part in the connection, the gut-brain axis. I think for sure, if I were to look for a connection between autism, right? And the vagus nerve, it will be a bingo because of that gut brain disruption that we see in people with autistic problems. Yeah, and there you have the impact of nerve. Yeah, the vagus nerve and autism, an overlooked factor. Powerful connection between the vagus nerve and autism. Yeah, I mean, it just makes all the sense in the world because that's what they have. They many times your autistic people have huge motility issues, very difficult, and then also so it's not, this is central. This is like really central. The vagus nerve is central to all of health, I think I could safely say. The vagus nerve plays a key role in the regulation of peristalsis, which is the coordinated muscular contractions that propel food through the digestive tract. We have nothing to do with that. There's absolutely nothing that any movement we can do or pushing or anything like that. That does not, we can't make our intestines do that natural contraction. It's involuntary. When the vagus nerve is functioning properly, it helps maintain regular bowel movements by promoting the rhythmic contractions necessary for smooth stool passage. Like it's going on all the time. You don't really feel it until it gets to the point where you need to pay attention because now you have to use the bathroom. So you need to feel it at that point, right? So you get where you need to go. And that's that, but it's going on all the time. It's going on throughout every phase of digestion. Imagine a well-orchestrated dance routine where each muscle in the digestive tract knows its part and moves in perfect harmony. The vagus nerve acts as a choreographer, ensuring that every contraction and relaxation happens at the right time and in the right sequence. This coordination allows food to move seamlessly through the digestive system, ultimately leading to regular and effortless bowel movements. However, disruptions in vagus nerve function can result in decreased muscle contractions, leading to a slowdown in bowel movements. It's like a misstep in the dance routine, where one dancer misses a beat and throws off the entire performance. Similarly, when the vagus nerve is not functioning optimally, the smooth flow of stool through the intestines is disrupted and constipation can occur. Picture a traffic jam on a busy highway. The cars are moving slowly, if at all, and the congestion keeps building up. In the same way, when the vagus nerve is not working properly, the stool remains in the intestines for a long duration, becoming harder and more difficult to pass. The lack of regular muscular contractions slows down the transit time, allowing water to be absorbed from the stool, making it dry and hard. And so that's what okay, so first, you didn't have normal peristalsis. You didn't have those muscular contractions. So what happens? The stool stays in there, and over time, the water in the stool that's been making it softer and easier to pass goes back out into the body from the intestinal wall and makes the stool hard and making it even now harder to pass with your lack of peristalsis in the first place. So that's just a miserable situation. Why we use cheap, inexpensive, poorly absorbed forms of magnesium, such as oh, this is from Kathy in the chat. And yes, I did absolutely get that email, Kathy. I'm glad you brought it up. So Kathy, Dr. Kathy is our classmate here who had the stroke several months ago, full stroke, major stroke. And she is going to the Mayo Clinic to see if she's a candidate for vagal nerve stimulation for more motor movement. Wonderful. That is fantastic. I think I did get that email. I got an email about that you were approved for another program. So I think that this might be more recent. So that's fantastic, Kathy. I mean, that is really awesome. And they're right on. More vagal stimulation, because they can use fancy things for vagal stimulation beyond the crude tools that we have that we can just do ourselves. They can actually implant a vagus nerve stimulator into your, I don't know if they would do that, but they can implant stimulators straight into your body, like they do a pacemaker. And I would think that they would be doing something, probably be doing something like that. That's fabulous. Tell me more, tell me more. I can't wait to hear more. So anyway, I was saying we use magnesium in poorly absorbed into the cells of the body, so it doesn't do you much good for your magnesium sufficiency in your body, but stays in the colon, and the magnesium pulls water from your body into the colon to soften the stool. So if you have constipated hard stool for whatever reason, there's a tip while you're trying to get your vagus nerve. Okay, so they are implanting. Yeah. Wonderful. Yeah. Kathy was just saying that that's how they do it, by implanting the vagus nerve stimulator. I had a client at one point in time who had such profound depression that they used a vagus nerve stimulator, and they implanted it right here. And that would affect her neurotransmitters in a way, and she was just recalcitrant to any type of medication. Didn't work, and her depression was profound. I mean, it was disabling. So very interesting. Okay, so then we have that. So you kind of get the gist of that. So this was very interesting. So I was like, this client had, oh, plus another thing that I didn't put in here yet is temperature regulation. Has a big deal to do with temperature regulation. And this particular client had the lifelong history of constipation, a very debilitating history of endometriosis for several decades, resulting in hysterectomy and everything eventually. And poor temperature regulation. So worsened with menopause, but just hot flashes, more than just hormonally based. So anyway, but one of the things, so I was like, well, let's look into that. Let's see if endometriosis might have any, if vagus nerve, why not? Doesn't hurt to ask, right? So the impact of vagus nerve on endometriosis, a comprehensive analysis. Are you kidding me? It's like bingo again. So endometriosis, again, is a complex and often misunderstood condition that affects millions of women worldwide. It's a chronic disorder in which the tissue similar to the lining of the uterus, known as the endometrium, grows outside the uterus. And this misplaced tissue can develop in various areas, including the ovaries, fallopian tubes, and pelvic cavity. The presence of endometriosis can cause a multitude of symptoms and significantly impact a woman's quality of life. The exact cause of endometriosis remains unclear, but researchers have proposed several theories that may contribute to its development. But anyway, we've got this misplaced tissue. It can often lead to debilitating pain. I had endometriosis, and I had very heavy periods as a teenager. After I had my daughter, that the heavy periods sort of cleared up, but I had trouble with hormonal imbalance. That was eventually conceiving again. I mean, carrying a pregnancy again, making enough progesterone. I conceived without any difficulty. But anyway, my story. But that was mild to moderate endometriosis, which causes a hormonal imbalance. But women with the chocolate cysts, where they're really gunked up with a lot of adhesions and things like that, that can be a real mess. That can involve your other internal organs, your bladder, your bowels, all kinds of things, and can block your fallopian tubes and just be, anyway, it's something you don't want. Okay, so you can read more about that if you want to, but emerging evidence suggests that the vagus nerve may have a profound influence on the development and progression of endometriosis. Here we explore two key aspects of this relationship: the vagus nerve's influence on inflammation and on hormonal regulation. So one notable aspect of endometriosis is the chronic inflammation occurs in affected areas. Is that chronic inflammation occurs in affected areas? This inflammation can lead to pain, tissue damage, and the formation of adhesions. Researchers have found that the vagus nerve has anti-inflammatory effects, and its stimulation can help reduce inflammation. We talked about a little earlier. When the vagus nerve is activated, it releases neurotransmitters such as acetylcholine, which can inhibit the production of pro-inflammatory molecules. This inhibitory effect can help modulate the immune response associated with endometriosis and alleviate symptoms. Furthermore, studies have shown that the vagus nerve can also regulate the activity of immune cells in the affected areas. By affecting the vagus nerve, it may be possible to suppress the activity of immune cells that contribute to the inflammation seen in endometriosis. This to me is huge. More information research is needed. Hormonal regulation and the vagus nerve. Hormonal balances play a significant role in endometriosis, as the growth and regression of endometrial tissue are influenced by hormones such as estrogen and progesterone. Interestingly, studies have shown that the vagus nerve can influence hormone levels and their effects on the body. The vagus nerve has connections to various glands and organs involved in hormonal regulation, including the hypothalamus, the pituitary gland, and the ovaries. Through these connections, the vagus nerve can modulate the release of hormones and their interactions with target tissues. Hormone that regulates the production and release of estrogen and progesterone by targeting the vagus nerve. Researchers hope to develop innovative approaches that modulate hormonal regulation and provide relief for individuals with endometriosis. That's really cool, right? Because if you're successfully addressing the vagus nerve, then you're doing both. You're not like, okay, I use this technique to deal with the hormones and I use that technique to deal with the inflammation. You use the same techniques. Vagus nerve stimulation. Vagus nerve carries potential risks that must be evaluated, complement infection, vocal cord dysfunction, blah, 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 blah. Jordan's question, is there any relationship between the vagus nerve and the trigeminal nerve, or can the vagus nerve interact with interreact with giant cell arteritis? Yes. And yes, I'm sure of that. But let's do a quick look. The trigeminal nerve is right out there springing right down. I think the trigeminal nerve is the, can't remember which cranial nerve that is. You're thinking of the glossopharyngeal, I think is the 7th, or it's a 9th. But anyway, let's see, relationship between 5th. Okay. The trigeminal nerve and the vagus nerve. Okay, yeah, and an understanding of the role and the trigeminal and vagus nerve and the role of the vagus nerve and trigeminal nerve and health. I like this one. The understanding of the trigeminal vagus nerve relationship can help one tune out pain and fear. Very interesting. Very good question. I'm going to look into that more and I'll put some information up on my page in the future. Very cool. And then, okay. Anyway, reduce vagal activity, blah, 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 blah. And then here I have a brief overview there of endometriosis and vagal tone, which is basically in a short few words tells you basically what we just said. And then looking at female reproductive health overall, reduce vagal tone in women with endometriosis and auricular vagus nerve stimulation is a potential approach. And this is going to take us actually to a study. Consequently, boosting the vagus nerve activity may have therapeutic potentials for patients with endometriosis. And then the impact of the vagus nerve on menstruation. And so again, you can read there on autonomic nervous system, on female reproductive system, hormonal regulation, vagus nerve and uterine function. menstruation and the nervous system. How the vagus, yeah. So very, very, very fascinating. It's just like a nerve that ties everything together. And yet so many people, unfortunately, suffer from its need of better vagal tone. Blood pressure regulation of the cardiovascular system is huge for this. Blood pressure regulation, the vagus nerve plays a role in maintaining healthy blood pressure by helping to regulate the balance between the sympathetic and the parasympathetic nervous systems. Although, wait a minute, through its parasympathetic signals, it promotes vasodilation, widening of the blood vessels, and slows the heart rate, both of which help reduce elevated blood pressure. It also communicates with baroreceptors, pressure sensors in the arteries that detect changes in blood pressure and relay this information to the brain, which adjusts vagal output accordingly. It's like all messages back and forth, back and forth. When vagal tone is strong, the body can adapt more effectively to changes in posture, stress, or physical exertion without significant spikes in blood pressure. Heart rhythm, this is another big one. The vagus nerve is deeply involved in regulating heart rhythm, especially by slowing and stabilizing the heart rate. It sends parasympathetic signals to the sinoatrial node, the heart's natural pacemaker, which helps counterbalance the stimulating effects of the sympathetic nervous system. Strong vagal tone leads to greater heart rate variability, a sign of cardiovascular resilience and adaptability. Low vagal tone, on the other hand, can contribute to irregular heart rhythms, arrhythmias, or an exaggerated heart rate response to stress. Supporting vagus nerve function is a natural strategy for promoting a steady, healthy heartbeat. And then by doing that, you, by keeping your heart rate and your heart and your blood pressure regulated through nursing and the TLC to your vagus nerve, you can then make changes to problems that occur when those anatomical changes, such as left ventricular hypertrophy or stiffening of the arteries leading to atherosclerosis, or the stiffening of the arteries. All of these things are together. So taking care of your vagal tone is going to really help take care of your cardiovascular tone as well, if you will. Mental health, we just know this, the fight or flight, the anxiety, all of that. So don't need to say too much there. But if you are prone to anxiety or panic attack or any of those things, or depression or anything like that, vagus nerve stimulation is hugely important and can be very helpful. Oh, wow. Postural orthostatic tachycardia syndrome, POTS, that's a very complex situation. And the vagus nerve is very key there. So people who have that, is not a good thing to have. It's a form of dysautonomia where the autonomic nervous system is off, right? Doesn't regulate heart rate and blood pressure properly, especially when shifting from lying down to standing. This is different than just orthostatic hypotension, where you feel dizzy when you stand up too quick. This is like severe, and the blood just doesn't want to move back up from your bottom of your legs up to the head. Dizziness, fatigue, brain fog. The vagus nerve plays a key role in this regulation by slowing the heart rate and stabilizing blood pressure through its parasympathetic influence. In people with POTS, vagal tone is often low or inconsistent, allowing the sympathetic fight or flight system to dominate. And so you'll have heart rate problems and all of that. Tachycardia, right? Postural orthostatic is racing heart, tachycardia. Improving vagal function can help restore some balance and support better autonomic regulation in those with POTS. And then some of the things that we do to, we're running late here, to stimulate the vagus nerve are these slow controlled breathing, cold face immersion or splashing. I actually had up here a, for sleep. Oh, thought I actually had like, I thought I had the cold water thing for that. But anyway, that's one of the things. And they say icing your neck for sleep problems, like icing your neck, like for a while before you go to bed. But anyway, that's why the polar plunge is so good for your health, right? Because it just resets the vagus nerve. So these are particular for POTS, because you have to be a little bit careful with POTS because of the sensitivity. So these are ones that are kind of POTS approved, but they work for other things too. Applying cold water to the face or using a cold compress on the neck stimulates the diving reflex via the vagus nerve, helping to slow heart rate and improve orthostatic tolerance. Then we also have compression garments. That's for POTS, because you need to try to get the blood back up. So that's not vagus nerve only or specific. Hydration and electrolytes. Okay, gentle movement practices, yoga, tai chi, supine stretching can gently stimulate the vagus nerve without triggering excessive sympathetic response. Singing, humming, or gargling. Okay, so anyway, here are some of the things you can do. Deep, slow breathing, humming, chanting, or singing, gargling with water engages throat muscles connected to the vagus nerve. Cold exposure, yeah, problem swallowing can also be vagus nerve related and would typically be most likely the guess if you have trouble swallowing. Cold exposure, meditation and mindfulness, acupuncture and auricular ear stimulation, probiotics and gut health support. The vagus nerve gland, we talked about microbiome a little bit. Intermittent fasting may enhance vagus nerve function by improving metabolic and autonomic balance. Omega-3 fatty acids, yoga and tai chi, laughter and social connection. I love that. Massage and reflexology, transcutaneous vagus nerve stimulation, which is what Kathy's going to be having done. Devices that stimulate the vagus nerve. Oh, I don't know how they're going to do it for her, whether they're doing the ear or what. But anyway, it's going to be done mechanically. Regular physical activity. And you can see some links here to things that you can do. 3 different breathing techniques. Why humming is the easiest way to relax, and that's all about the vagus nerve. That's also, when people are meditating and do that the stimulation of the roof of the mouth, that's what is involved there. But singing, and singing, you start to breathe properly too if you're singing. So if you're in your car all by yourself, just let it out, sing along, and humming, gargling to stimulate the vagus nerve. These are all things that are easy to do, incorporate into your daily. Polyvagal theory, finding connection through play and silliness. That's good. Play and silliness, laughing and all of that. The role of play and silliness. There you go. That's a good note to kind of wrap up on. And then here we go. This is kind of power of, these are going to go into things that are things like yoga, like tai chi, things that help you with these movements and sustained, all of that, and the breathing that comes with it. That was a busy page. I hate busy pages like this. You can turn this on. This is Dr. Cheryl, chiropractor, and she's talking about this vagus nerve stimulator that I actually, that's what I showed you. And I'm not going to take the time to demo it because you can do that. You just go here, you watch her, and she'll do it. If you click here, you can purchase it. We have them. You see that right there if you want to do that. And then I have a sheet that details the, it's got the video there. And then also the clicker positions are the right of the belly, how you do it. Okay, so this is what you do. Hand here, behind the ear, 3 fingers up here, while clicking to the right of the belly button, at the belly button, and left on the belly button. 3 fingers to the top of the head, 3 fingers to the hairline, 2 fingers at the eyebrows. Ooh, gives you a little, it feels good. It feels good. So you're getting and you're connecting from down here to up there. And when I do it to somebody else, or you do it to somebody else, you'll feel the spark as it comes up from their lower body up here. When you do it to yourself, it's a continuous feedback loop. So it's not as, you don't feel it in your fingertips, but you'll feel it down here. Very, very fun. So you can get that there and you can just, and you can watch her do it. So you'll have all the information there you need to do it. And then earthing for vagal tone, earthing, grounding for vagal nerve activation. We talked about that a little while ago. And again, yeah. So then you can see how it works through all of that. And that's a great way to do it. Again, a lot of tools that can be used to do this, but you have to do them. I think that that's the main takeaway is, you know, like Kathy's going to get something implanted in her somehow, and that's going to be an ongoing vagal stimulation. But the rest of us are on our own. And we don't have Kathy's, at least I don't. Maybe somebody else watching does, but have the challenges that Kathy does post-stroke. But for sure, we can do these things. We just have to make a point to do them. And I think also my major takeaway here would be, if this resonates with you, or a family member, maybe a child with chronic constipation or something like that, and there's my phone, then take this information and put it to work for you, because you can make a really big difference with your health if you know how. So let's all get supporting our vagus nerves. Every single one of us can benefit from it, I'm sure. Okay, I'm going to let you go. I've gone over time. Have a wonderful day. I'll be back next week, and I hope you have a great weekend and a wonderful week next week. Take care and be well.